Morning, everyone. Welcome to today's town hall on March the 7th. We'll get started in just a minute. I want to leave a few moments for everyone to join who was able to today. So just wait until our participation creeps up a little more. It's actually joining quite fast today, so this is good. There's some excitement in the air. It's yet another sunny day out there, which is a nice thing. Okay, so just a little housekeeping off the top for today's town hall. We have a really stellar agenda lined up, and we'll have the Q&A function open for you to type questions in. Could be about things in the presentation or other questions you wish to ask, and our panelists will do their very best to answer right away, and those answers stack up in the Answered tab in the Q&A function. So please do that. Of course, there will also be an opportunity at the end for you to email questions in. If there's something that comes to mind later that you didn't get to raise today, we'll put that information up later. The chat function will be open at the end of today's presentations for our celebrations, as always, and would encourage you to think about any particular teams or colleagues or moments or accomplishments that you'd like to call out today, any milestones or celebrations that you wish for everyone to know. You'll be able to type those in the chat, and we'll also have the opportunity for you to raise your hand and give your shout out or celebration live. So that's all from me today. I know Rob McIsaac couldn't be here today, but very pleased to have Sharon Pearson, our Chief Operating Officer and Chief Nursing Executive, to lead the charge today. So Sharon, over to you.
Great, thank you. Good morning, everyone, and very happy to be here today on March the 7th for Rob. I'd like to start by acknowledging that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. I'll begin today by acknowledging a few upcoming observances that will occur over the next month. The first is tomorrow, which I'm sure everybody is aware is International Women's Day on March the 8th. This is an annual global observation and recognition and celebration of the social, economic, cultural, and political achievements of girls and women around the world. And it is also a time to raise awareness of the progress made towards achieving gender equity that still needs to be done. This year's theme across the world is Inspire Inclusion. Certainly our organization's workforce is primarily comprised of women, and I'd like to recognize the thousands of women at HHS that have made countless and critical contributions over the decades in a multitude of different roles and facets. As always, our EDI team has planned and curated a number of events in celebration of tomorrow, including a lunch and learn about advancing gender equity and women's rights. So if you could please go to the hub, all the details are posted there. Also, in a few short weeks, it's International Transgender Day of Visibility, which will fall on March 31st. This is another global day of celebration to celebrate and honor transgender people and increase visibility and awareness of the community's struggles and triumphs. Information in regards to the Transgender Day of Visibility will also be posted on the hub, but a bit closer to that date at the end of March. I would also like to acknowledge a very poignant day for people around the globe, healthcare workers especially, and we see this coming up in the media in recent weeks. March 11th marks the 4th anniversary of the declaration of the global COVID-19 pandemic. And I'm sure, like you, I find it really hard to believe that it was 4 years ago, and it has changed your world and our worlds significantly. And while it's declared over, certainly the impacts of the pandemic are a very present reality in all of our worlds today. First off, March 11th is an opportunity for us to remember the many lives that were lost to COVID in our own hospital, in our own community, and some within our own families. But it is also a time for us to reflect as an organization on what we achieved in spite of these immense and inordinate challenges in the most unstable period of our health system. The teams in the midst of the pandemic found new ways of working together that resulted in some very important improvements to care. We forged wonderful new partnerships in the community that will and are serving us well into the future. And more than anything, we provided unwavering life-saving care to so many patients and families when so much was uncertain in everyone's lives. This is a huge legacy for our organization, for all of you that contributed to this. It is one you should all take pride in, and I hope that you will always keep that in your hearts. And we will continue to serve our community and our hospital well. So with those few opening remarks, I'll just quickly shift to my regular operational update. In terms of the COVID numbers, there we are marking the 4th anniversary, but we do still have some COVID patients, 37 across the organization with less than 5 of those in the ICU. We do still have a few RSV patients, as you'll see, 22, again, less than 5 in ICU. Influenza patients, 60. We only have 2 respiratory related outbreaks. We do have a few other outbreaks in the organization, but these 2 are respiratory specific. Next slide, please. While we have felt some of the occupancy pressures subside, we still maintain an occupancy across the organization of greater than 100% and over 105% in our adult sites, and also a higher ICU occupancy as well, as you can see there. The discrete occupancies are listed at West Lincoln as feeling some inordinate pressures, as we see also at the JH, and really all of the sites. We'll talk a bit more specific in a minute. And our ALC numbers have been somewhat stable, typically between 245 and 270 patients. Next slide, please. In terms of where we are compared to January, our occupancy is a bit lower, so we were consistently above 110% in January. That's related to some decline in our ED volumes, which are stable, and also a decline in the respiratory visits and admissions that we're seeing. We are seeing a rise in our ambulance visits, though, and that's an occurrence across the city. Again, noting a reduction in the respiratory-related outbreaks. Ambulatory volumes within the adult population are unchanged, and I did note where we're at with ALC. The next slide, specific to the pediatric population, lots of pressure at that site. The ED volumes are much higher than they were last year, and you can see 20% higher when we compare February to February. And NIC occupancy continues to be quite high and very pressured activity within that unit, and challenges across our Ontario West region with level 2 capacity. Our labor and delivery volumes are high, and also our pediatric inpatient occupancy has been consistently over 100%. And unlike the ambulatory and the adult, our pediatric volumes are higher compared to last year. And Dominic's going to talk a little bit about the response to measles. Next slide. In terms of our surgical activity, we have been able to increase in terms of OR capacity at the Juravinski. So all 9 operating rooms are up and running, and they're over their 100% utilization. We continue to increase at the McMaster site as we address some of the health human resource shortages that we have. And we are incrementally increasing at the Hamilton General site, now just above 90% of our pre-pandemic volumes, and also increasing at the West Lincoln site. And the next slide. I just wanted to highlight this because we had brought this forward at previous town halls in the inordinate work that was done by the teams as related to the ambulance offload time. So just a couple of quick visuals for you here across the x-axis. You can see in the blue the provincial 90th percentile for ambulance offload, and the red line is the time at the general on the left and the Juravinski. So you can see the massive improvements made at the sites, much of that attributed to an improvement in bed capacity and some additional funding we received for those beds, along with process improvements within the team. So thanks to both sites and the team for inordinate work on that. And then lastly, in terms of other work in progress, certainly continue to stabilize the workforce. We are seeing a decline in our nursing vacancies, particularly our RN vacancies. We do still have, though, some very persistent discipline-specific challenges, and also some areas where the pressures are more intense than others across the units. Lots of work happening in the workforce planning and the models of care work, and we'll continue to bring that back to this forum for updates. And as always, as I highlight, we continue to maximize our post-acute capacity within the satellite and health facility in St. Peter's, but also with our community partners. And as I've also highlighted, our admission and visit avoidance strategies with our hospital home, our discharge to assess and other models with partners to mitigate the pressures on our ED department. So with that, I will hand it back over to Aaron.
Yeah, thanks very much, Sharon. Some rich information there about what's happening across our sites and services. As Sharon mentioned, a decline in respiratory visits, but measles, unfortunately, in our space. And to give us a little bit more on what's happening, Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control. Dr. Mertz, what do we need to know this week?
Yeah, thanks, Aaron. And as already mentioned, I will shift the focus a little bit from our usual ARI numbers to some updates around measles in my last part of this presentation. So first, relatively briefly around ARIs. Next slide, please. So this is Ontario-wide, and we see the same in our region. Obviously, acute respiratory viruses continue to decline. In particular, COVID is roughly at half the rate it was around the same time last year. So we had a slightly later peak, but it's coming down more quickly as well than what we saw last year. We also see a continuing decline in RSVs and flus, which are still around as well, but numbers are certainly declining, but are still higher than last year at the same time when we had a much earlier peak for those viruses. Next slide. Talking about those other respiratory viruses using the McMaster Children's Hospital data here, number of patients admitted on a given day with ARIs. You can see from that perspective, we peaked back in end of November, as typical in pediatric, mostly driven by RSV. Then we had quite a bit of rhinoentra as well, which came back surprisingly in February again, and it's now again on the decline. And then COVID, you see at the bottom, the gray line that contributes somehow, but certainly not to the same extent that flu and RSV in particular would. Relatively stable, I would say, since January in terms of number of patients that we see at the Children's Hospital admitted with acute respiratory infections. Next slide. COVID outbreaks, this is not Hamilton specific, this is Ontario-wide. At the bottom, the yellow one is number of COVID outbreaks across the province this year compared to the previous years. And you can see this year is going much, much better than last year, and most certainly much, much better than 2021, 2022, when we had that very high peak at the end of the, or around the year end with the first Omicron phase. Next slide. Talking about Omicron, this is our current Omicron soup, and as previously discussed last time, roughly 4 weeks ago, JN1 is the Omicron subvariant that became predominant as predicted. That's that one color that predominates, that teal-like color on the right-hand side. But you see there's still other subvariants as well that continue to be present. Next slide. Here you can see that JN1 is at roughly above like 60–65%, but seems to plateau now. So it doesn't look like it will be at 90–100% as we've seen with some subvariants in the past. So it looks like it's going to plateau, and then it's probably a matter of time and some other subvariant will take over from JN1. Then you see the other JN1.124 more at the bottom. JN1.4 is the one that shows most growth at this point. But again, it's a mix at this point with JN1 standing out as the most common subvariant. Next slide. In the light of the changes of the frequency that we see acute respiratory virus infections and the decline in outbreaks since the beginning of the year. As you probably all have heard, we went back to sort of routine masking across the board. So no more routine or mandatory masking for all patient contacts as per March 4th. Which is in alignment with other regional hospitals and as well as with the long-term care sector, which made the same transition on Monday. Masking will continue in certain areas and certain interactions. So situational masking, that's the terminology that we use for what you would have always been done or been asked to do when patients are in additional precautions, or if your PCRA indicates that masking would be indicated. We continue with protective isolation in the sense of masking in all patient contacts in certain areas where we have our highest risk transplant patient population. It continues upon return to work as instructed by employee health services. And of course, you can continue to mask based on your personal choice. Next slide. Now, measles. I think you're all well aware that we have had a case of lab-confirmed measles going through the Children's Hospital. It was all over the media locally and also provincially. We are certainly not the only city or jurisdiction struggling with an increase in cases. There's been several travel-related cases of measles in Canada with an increase over the last few weeks or months. The latest cases in York, in the York region, as well as in Montreal, have an unknown source. So indicating that community transmission does happen at this point, and it's not only travel-related cases anymore. We will see how this develops from here, whether those clusters can be brought under control or whether we will see more community transmission happening. In Hamilton, so far, we haven't seen any community transmission, and I'm not aware of any secondary cases from that one case that went through the Children's Hospital. There's lots of work happening in the background to improve vaccination rates, which is the key response to measles for sure, and also to facilitate access to testing optimally outside of our EDs. What can you do if not already done so? Get your second MMR shot if you haven't had one, or you're immune, and the definition of immune includes if you were born before 1970. Get your N95 respiratory fit testing done if not done yet or not up to date, and be vigilant for cases, patients that may have measles, and you may have seen the posters, or you will see the posters on the right-hand side that currently would flag patients who have had either potential or confirmed measles exposure in the past 28 days, or who would have traveled outside of Canada in the past 21 days and have symptoms suggestive of measles. Now, the challenge with that, as you may know, is that those symptoms are pretty similar to what you may have with many respiratory viruses: cough, rash only later on, fever, runny nose, and pink eye. But those patients at this point, as long as we can sustain that, should be isolated up front until they can be assessed whether they may need testing for measles. Next slide. That brings us to my summary of where we are today. So we are well past peak of a relatively normal respiratory virus season. JN1 is the latest Omicron subvariant that behaves like many before that. It becomes predominant with no major impact or sizable impact on either epidemiology, morbidity, or mortality. A universal masking requirement for all patient contacts was lifted as per March 4th. And we ask you to be vigilant about measles, get your second MMR dose if needed and not done yet, and your N95 fit tested, renewed if needed. With that, I'm handing over back to you, Aaron.
Yeah, thanks very much, Dominic, for that update today. Very much appreciated. Next up on our agenda, we're joined by Rochelle Reed and Naham Azam Iqbal. Rochelle's our Senior Lead and Strategic Advisor for EDI, and Naham is our Manager of Equity, Diversity, Inclusion. And they're going to talk about just as it says on the slide, EDI governance structure and champions. Rochelle, Naham, over to you guys.
Thanks so much, Aaron, and good morning, everyone. As most of you know, we've launched our 5-year EDI plan back in June, which outlines our deliverables and objectives that will help us move closer to becoming an organization that is more inclusive and fosters a culture of belonging. In order to mobilize on that plan, we've established an EDI governance structure that will provide strategic oversight and accountability for the implementation of the plan. So within the governance structure, the EDI steering committee will be comprised of members that will have direct responsibility to deliverables as outlined in each of the 4 strategic pillars of the plan. The steering committee will also be informed by the working groups that will be tasked with executing on project plans. The working group leads will consult and inform the EDI steering committee on progress and of initiatives and projects. We will also ensure that there are linkages with other corporate strategic priorities across the organization to ensure that we have that sustainability piece baked into our EDI ecosystem. We will also be establishing a consultative function that will formalize how we engage with various equity-deserving communities. So as part of this structure, we will be looking for some EDI champions to play a vital role in supporting this work. And here to share a little bit more about what the EDI champions role is, I will turn things over to Naham.
Thank you, Rochelle. So as Rochelle mentioned, to progress EDI, the transformation initiative at HHS, we'll be developing an EDI steering committee and those working groups to implement the EDI plan. And the EDI champions are going to be vital to this work. As members of the HHS workforce who are interested in cultivating an environment that embraces EDI and principles at HHS, and that can utilize their experience and understanding of our organization to support advancing EDI on various committees and working groups that we had spoken about. Next slide. So should you become an EDI champion? So if you're a current member at a staff member at HHS and are able to commit an hour or 2 per month to the working group meetings or steering, and that you have a strong commitment to EDI principles and enthusiasm to support implementation of the EDI plan. We're encouraging members who identify as members of equity deserving or staff members who are members of equity deserving groups such as racialized individuals, LGBTQ plus individuals, and people with disabilities, and others who have historically faced systemic barriers. We're encouraging you guys to apply. Next slide, please. And how do you apply? So to apply, there is a form available on the hub. It went out in dispatch today. And the applications to be member of the EDI steering committee specifically is due by March 20th as we ramp up that work. But as you put your applications in, they'll will also be considered for working groups that'll be formed on an ongoing basis. Once you've completed the application, a member of our team will reach out to you about next steps. And feel free to reach out to the inclusion@hhsc.ca email if you have any additional questions about the process. And that's it from me.
Yeah, thanks very much, Rochelle and Naham. It's some exciting developments in work for sure, and a nice invitation to the workforce to participate. So I'm sure you'll have lots of uptake on that, no doubt. Now, well, just a reminder, as I said at the beginning, you will have the opportunity to send any questions that you didn't raise today, but would like to the email address hhsnews@hhsc.ca, and we'll make sure to get you a response as soon as we are able. Now is the opportunity for celebrations in our agenda, and the chat function is open. You can type celebrations into the chat. You can also, whether you're a participant in our audience today or a panelist, raise your hand and you can give your shout out live. Of course, this is a chance to recognize your colleagues or teams, any milestones that have been achieved in the organization. The floor is open. Yeah, there we go. I see Yelena with the hand up. Yelena Potts, what would you like to celebrate today, Yelena?
Yeah, just wanting to thank our infectious diseases, our IPAC team, many stakeholders, including our communications team that just really came together following that measles exposure and just worked flat out and are still working flat out to make sure that we could support the families that were affected, but also make sure that we're fully ready as an organization. So thanks to everyone, probably worked many, many hours beyond their regular days.
Fantastic. Thanks, Yelena. Leslie Gillies, what would you like to celebrate today?
Thanks, Aaron. Just wanted to recognize the lower limb preservation team, many partners, stakeholders in the community and hospital and physicians and staff, but Danielle Petrocelli and Tina Petrelli and Dan Van Veen. We did have received good news this week that our funding has been extended for an additional year, and we're one of 11 regions within or organizations within Ontario for lower limb preservation extension. So great work that has been done, and we look forward to continuing that into 24-25. Thanks.
Fantastic. Thanks, Leslie. Tim Dietrich, you've got your hand up. What would you like to celebrate, Tim?
Thanks very much, Aaron. I just want to build upon the slides Sharon showed earlier around ambulance offload time. We met on Monday with Susan Piccarello, the Assistant Deputy Minister for Emergency Health Services Division of the Ministry of Health, or sorry, with the Ontario government, excuse me. And Susan's congratulated Hamilton Health Sciences on our ambulance offload time improvements and our current performance to the point where she's saying that we're highlighted in ministry meetings. Our performance comes up frequently. Our ability to have innovative ideas and our willingness to work together was outstanding from her perspective. And currently, our performance at a few of our sites are at or below the provincial target, which is phenomenal for a problem that we had trouble solving. So to ED staff, ED leaders, those that were involved in the Lean A3 work, I'd just like to say congratulations and thank you.
Yeah, thanks, Tim. A few in our chat function here. We see from Louise McCrae celebrating our facility dog, Hank, who has made many enjoyable visits to our teams at the Hamilton General Hospital these past few weeks. Thanks for calling that out. From Kaylin Pettit, thanks, Yelena, and all who have partnered with the communications team to ensure a swift response. Catherine Duffin recognizing our social work colleagues during Social Work Week. Very important. From Gabrielle Martel, GIM teams at the Hamilton General Hospital for a great flow in the last few weeks. From Bruce Squires, celebrated at the recent Hamilton Health Sciences Research Gala for excellence in early career research in women's and children's health, Dr. Michael Livingston, Dr. Deborah Sloboda, Dr. Matthew Leonardi, Dr. Amanda Sim, Dr. Jenna Dowaniak, and Dr. Rahul Chanklani. Thanks, Bruce, for shouting that out for sure. And Mike, I see your hand up. I'm just going to keep going. I'm on a roll and I'll get to you in just one sec. From Rachel Schofield, a shout out to the hematology social workers and all social workers during Social Work Week who support our vulnerable population across the stem cell transplant care pathway. We could not do without your work, or do our work, excuse me, without them, for sure. From Todd Milne, congratulations to Andrew Moll, our Manager of Emergency and Disaster Management, or EDM, achieved a mastery level of healthcare emergency manager designation at his most recent conference. Thank you for continuing to advance your own education and skill set to better support the EDM program at Hamilton Health Sciences. Your leadership and ongoing support in EDM is valued and appreciated. Congrats, Andrew. Again, from Yelena, recognizing our Child Life team under the leadership of Tracy Ackett. You all make a huge difference for our children and make coming to receive care so much better. From Kimberly Balker, celebrating Child Life Month. Huge thanks to our amazing Child Life team members for supporting our patients and families across Hamilton Health Sciences. From Jenny Proba, the Ontario College of Pharmacists are on site this week for pharmacy accreditation. A tremendous amount of preparation from the teams went in to ensure that the sites are recognized and celebrated for their great work in medication preparation, administration, and delivery. And congratulations. Oh, Leslie Gillies, you're stealing. Yeah, a colleague of mine in Human Resources, Jennifer Bowen, who celebrated a 40-year milestone just this week, exemplary service. Thank you, Jennifer, for all you've done for Hamilton Health Sciences. I'm going to pause there, and Mike Campen, I see you have your hand up. Please, let's unmute.
Yeah, I think some of it's been covered, but I just wanted to recognize it's Nutrition Month for March, so that we're recognizing our registered dietitians and registered dietitian assistants. And as well, it is Pharmacy Month, and somebody highlighted already Child Life Month and Social Work Week this week. So thank you.
Fantastic. Thanks, Mike. I just see here too. Let's take another look. I see another from Jenny Probra. Kudos to clinical practice and education to put on an annual review for the Hamilton General Hospital site. All right, well, a fantastic round of celebrations today. Lots to be proud of, so much happening. Sharon, I'll turn it to you to close us out. Thank you.
Great, thanks. Those were magnificent celebrations. Thanks to everyone again for all your work and efforts. You know, we continue to get challenged by something new, it seems, all the time. Now it's measles, but I know we'll all work together to overcome. So we have a wonderful team here. Thanks, everybody. Our next town hall is on April the 4th. Take care till then. Have a good day.